Hello and welcome to our YouTube channel. Today, we're going to learn how to use a home blood pressure machine. It's a wonderful tool for keeping an eye on your health, and I'll walk you through it step by step. Don't worry, it's much easier than it looks. Taking your own blood pressure at home is a great way to stay in control and informed about your well-being. By the end of this video, you'll feel confident using your machine all by yourself. Let's get started together. First things first, let's talk about what you need to do before you even turn the machine on. It's very important to prepare properly to get an accurate reading. For at least 30 minutes before you take your blood pressure, please avoid a few things. No smoking, no drinking anything with caffeine like coffee or tea, and no exercise. These activities can temporarily raise your blood pressure and give you a false reading. Also, it's best to use the restroom beforehand, as a full bladder can also affect your numbers. Find a quiet, comfortable spot where you can sit and relax for about 5 minutes. Just take some deep, slow breaths. This little bit of quiet time helps your body settle down, so the reading will be a true reflection of your resting blood pressure. Remember, preparation is key. Now that we're relaxed and ready, let's get our setup and posture just right. Sit in a comfortable, supportive chair with your back straight and your feet flat on the floor. Don't cross your legs or your ankles, as that can interfere with blood flow. Rest your arm on a table or an armrest so that your upper arm is at about the same level as your heart. This is very important for an accurate measurement. Your palm should be facing up. When you place your arm on the table, it should feel completely relaxed and supported. You shouldn't have to use any muscle to hold it up. Getting your body in the correct position is half the battle won, so take a moment to make sure you're comfortable and properly aligned. Alright, let's put the cuff on. Take the cuff and slide it onto your bare upper arm. It's important that it's on your skin, not over your clothes. If you're wearing long sleeves, please roll them up, or even better, wear a short-sleeved shirt. Position the cuff so the tube is running down the front center of your arm, in line with your middle finger. The bottom edge of the cuff should be about 1 inch, or about 2 fingers width, above the bend of your elbow. Now let's talk about how tight it should be. You want it snug, but not too tight. A good rule of thumb is that you should be able to slide 2 fingers under the cuff. If it's too loose, you'll get an error or a wrong reading. If it's too tight, it will be uncomfortable and also inaccurate. So, take a moment to adjust it until it feels just right, snug and secure. We are all set up and ready to take the reading. This is the easy part. Once the cuff is on correctly and you're sitting quietly, simply press the start button on your machine. The cuff will begin to inflate. You'll feel it getting tighter on your arm. This is completely normal. Just try to stay as still and quiet as possible while the machine is working. Don't talk, don't move around, just continue breathing normally and relax. The cuff will inflate to a certain pressure, then it will slowly deflate. As it deflates, the machine is measuring your blood pressure. The whole process only takes about 30 to 60 seconds. Once it's finished, the cuff will completely deflate and your results will appear on the screen. See? That wasn't so bad at all. Now that the measurement is done, let's look at the numbers on the screen. You'll see 2 main numbers. The top number is your systolic pressure. This measures the pressure in your arteries when your heart beats. The bottom number is your diastolic pressure. This measures the pressure in your arteries when your heart is resting between beats. For example, you might see something like 120/80. Some machines will also show a third number, which is your pulse rate, or how many times your heart beats per minute. It's a wonderful idea to keep a log of your readings. You can use a simple notebook or a logbook that might have come with your machine. Write down the date, the time of day, and both your systolic and diastolic numbers. This record will be incredibly helpful for your doctor to see the trends in your blood pressure over time. Let's go over a few helpful tips and common mistakes to avoid. First, always try to use the same arm for every reading. This helps keep your results consistent. Second, it's best to take your blood pressure at the same time each day. like in the morning before you take any medication or in the evening before dinner. This creates a routine and gives you a more reliable pattern. A common mistake is taking only one reading. For the best accuracy, take 2 or 3 readings, about 1 minute apart, and then average them. Another mistake is not resting before you start. Remember those 5 minutes of quiet time we talked about? They are very important. Also, be sure your cuff is the right size for your arm. If the cuff is too small or too large, the readings won't be correct. Most machines come with a standard size, but you can buy different sizes if you need to. Checking these small details can make a big difference. Keeping a regular check on your blood pressure is an act of self-care. It's a proactive way to manage your health. However, this machine is a tool for monitoring, not for diagnosis. It's very important to share your readings with your doctor or nurse. Bring your logbook with you to your appointments. They can interpret the numbers in the context of your overall health and make any necessary adjustments to your treatment plan. Never change your medications or stop taking them based on your home readings alone. Always consult your healthcare provider first. They are your partners in health, and your home readings give them valuable information to help you best. If you ever get a very high or very low reading, and you feel unwell, for example, if you feel dizzy, have chest pain, or a severe headache, please seek medical attention right away. I am so proud of you for taking this step to learn about your health. Using a blood pressure machine at home is a powerful tool, and now you know exactly how to do it. Remember to be patient with yourself as you get used to the process. It might feel a little strange at first, but soon it will become a simple and quick part of your daily routine. You are in control, and you're doing a wonderful thing for your future well-being. Keep up the great work. If you found this video helpful, please give it a thumbs up and consider subscribing for more health tips made simple. Thank you so much for watching and take good care.